to compare the Cauda-Equina syndrome and conus medullaris. We have the spinal cord. Here we have the end of the spinal cord. This is the conus medullaris, and here we have the nerve roots. Remember that at the end the nerve roots are like hang on, like this. So this set of nerves is called the Cauda-Equina. So Cauda-Equina syndrome is compression here of these nerve roots, like a disc herniation, but instead of just impinging on one nerve, it is impinging on many nerves. So this is Cauda-Equina here, and conus medullaris is compression here intraspinal cord. So conus medullaris would be, for example, a ependymoma that is compressing from the inside of the spinal cord. Cauda-Equina is due to disc herniation or metastasis, for example, small squamous cell lung carcinoma, or a epidural hematoma, spinal cord abscess, something like that. The most common would be due to a disc herniation, but here at this level. So here are compressing the L2, L3 nerve root or the Cauda-Equina, so it is at the level of L2, L3, but we are compressing all these spinal nerves. And in conus medullaris, the compression is usually at the level of C2 to C3, and it's the conus medullaris what we are compressing. So in Cauda-Equina, we will have lower motor neuron signs and symptoms, because we are compressing the lower motor neuron. And in the conus medullaris, we have upper motor neuron signs and symptoms, because we are compressing from the inside of the spinal cord. So here the patient will have areflexia, muscle weakness, stable anesthesia, both unilateral. All these symptoms are unilateral. There could be urinary incontinence, bowel incontinence, but these are late findings, and mild erectile dysfunction, but mild. In upper motor neuron signs, for the conus medullaris, we would have preservation of the reflexes. There would be mild muscle weakness. There would be severe sexual dysfunction and urinary and bladder incontinence, urinary and bowel incontinence. So they are kind of the opposite presentation: upper motor neuron, lower motor neuron. The diagnosis evaluation for both would be the MRI. Cauda-Equina is a truly emergency, even though the progression is a little bit slower. The treatment should be immediately given. So first the MRI and then the treatment. The treatment would be surgical decompression. And for the upper motor neuron, for the conus medullaris, there would be NSAIDs and radiation therapy. The disease progresses a little bit quicker, but the need to give the treatment is less emergent, is less an emergency than on the Cauda-Equina. So we have Cauda-Equina, compression of the spinal nerve roots with lower motor neuron, conus medullaris, compression of the tip end of the spinal cord, upper motor neuron signs. So Cauda-Equina, areflexia, weakness, muscle weakness, in bladder and bowel incontinence, late findings, and conus medullaris syndrome, sexual dysfunction, urinary incontinence, bowel incontinence, preservation of reflexes, and mild muscle weakness.